Asthmatic children between the ages of 5 and 17 years old have had a higher chance of being hospitalized with severe COVID-19 infection. That's according to the Lancet medicine study. Let's discuss this with the Paediatric doctor, Despina Demopoulos. Thank you so much, Despina, for your time. Speak to us about this recent study and what it's found, especially around the young ones, because we have been told that, especially during the fourth wave, they are being hospitalized even more and more than previous waves.
Thank you, Heidi. Yes, so definitely there have been many more kids infected during the Omicron wave, which is the fourth wave. But we have noticed that the children that have been infected or hospitalized have not been more severely ill than any of the other waves. So this study looks at poorly controlled asthmatics. And it's quite a small number of asthma admissions. It's only 67, so it's 1 in 380 poorly controlled asthmatics, which is quite a small number of asthmatic admissions. And those kids in this study appear to be much more sick with COVID in the ICU. We have not seen that in South Africa, and it might be related to the fact that we are in summer. We normally would see asthmatics that are poorly controlled admitted with any other virus. So it could be the same thing with COVID. But just checking with all my colleagues around the country today, and I looked at 13 ICUs around the country, there actually aren't any children that are admitted with acute asthma attacks. There are 3 or 4 pneumonias, but most of the admissions with children currently in the hospital are all incidental. So the children are admitted with something else. So, for instance, they've had a car accident or they've come in for a surgery. They've got something else and they've picked up COVID incidentally. So still the majority of admissions currently with children in South Africa are coincidental, incidental admissions with COVID.
So it's not that much of a worrying picture at this stage, because I think many were alarmed at the fact that the hospitalization rate percentage has increased this time around for the younger population compared to the previous wave. For example, we were told on Friday that in wave 2 and 3, it was about 5% of the younger population being admitted, and now it's over 20%.
Yeah, so actually looking at the studies that I was looking at, what the NICD have published today, this last week has actually been much lower than that. So even though they're looking at the less than 19-year-old group and they're saying more than 20%, if you actually look at those admissions and break them down, those admissions are not related, they're not admitted because of COVID. They are admitted because of something else, but they are COVID positive at the same time. So most of our admissions currently throughout the country with children in South Africa are, so a lot of incidental. Half the peds wards, the children have got COVID, but they don't actually have COVID pneumonias. There are, as I said, 3 or 4 COVID pneumonias, some croup, but a lot of it is incidental. So the children are not sicker in ICU than they were in the previous waves, which is great, actually.
Definitely. I think that's great news. It was such a worrying picture when we heard that children were being infected and hospitalized. Speak to us about how we deal with poorly controlled asthma, and how do we actually solve this problem?
So that's a great thing to talk about, because poorly controlled asthma, whether it be COVID trigger or RSV or adenovirus, these children will land up in hospital. So never mind the COVID pandemic, poorly controlled asthmatics are a huge problem. And we really, really encourage children or parents to make sure that their children are controlled with asthma. So to be followed up by a pediatrician, or if it's severe asthma, to be followed up by a pulmonologist, to get their regular treatment, and if there are any triggers. So these children often get triggered by any virus, as I said, but also by some allergies, atopy, dust, anything that, and you notice your asthmatic child is getting sick, then obviously to go quite quickly and seek help, because a child with uncontrolled asthma can definitely land up in the ICU, and those children are exceptionally ill once they land up in the ICU.
Being a doctor and understanding COVID-19 and asthma in young children, do you think that there needs to be a more concerted effort to have the younger population vaccinated, so those under the age of 12 or possibly even those under the age of 5? Do you think this will provide some kind of solution to the problem?
So they are doing that overseas, and definitely these vaccines are safe and will help our children, and we do feel that children with comorbidity should be prioritized, and asthma is a comorbidity. But the South African Paediatric Association, which is the hat that I'm wearing now, we definitely feel that there's still a huge adult population that needs to be prioritized in South Africa, and then our kids 12 to 17 or 12 to 18 still need to get their boosters, and those children with comorbidities do much worse. So those children with cardiac or asthma or diabetes or chronic kidney problems, those children really need to get their second booster. And then we will move on to the younger group, we hope, as they are doing overseas. So I do feel, and we do feel, that the vaccines are safe, and that any prevention of any illness will help an asthmatic kid. For sure it will. All the vaccines help asthmatic children. But right now, the priority in the country is still to do the older, sicker, or older population with comorbidities. And then if we can, and if we do have the stock, yes, like they are doing overseas, we should move on to our younger kids.
Great. Thank you so much for that update. I think it's very important for us to understand what's really going on, especially in the younger population. That was Dr. Despina Demopoulos. Thank you for your time.